So if we start off by looking at this trend in the United States, I mean, obviously going up here, this is June into July, coming down nicely, but what's it doing at the moment? You'd have to say it's probably fairly flat at the moment. And it looked like it was going down there, but now you can interpret that just as well as I can. And of course, these are the official diagnosed cases, and as we'll see, these are always underestimates. And the current active cases in the US have remained surprisingly constant, and this is since basically the middle of August. About 2.5 million cases, just over 2.5 million cases active at any one time in the United States fairly consistently. So you can interpret those trends as well as I can. Now, welcome to this video. Now, good news from the Antipodes. Let's say not so good news from Europe on this video. But sticking with the United States first of all, and a remarkably important principle. Centre for Disease Control, Morbidity and Mortality weekly report. Check it out for yourself. Changing age distribution of the COVID-19 pandemic. Now, this is what it's saying. Early in the pandemic, COVID-19 incidence was highest amongst older adults. Now, I'm not sure that's true, because these were the ones that were getting sicker, therefore were being more tested. So that certainly represents a higher proportion of older adults in those being tested, but whether it represents the actuality of the situation, I tend to doubt. But here we have some more definitive data. June to August 2020. Incidence highest in 20 to 29-year-olds in the United States as a whole. Accounted for more than 20% of all confirmed infections in that single decade. And of course, we've looked at many reasons for this as we've gone through these videos in recent weeks and indeed months of why this is probably the case. Younger adults likely contribute to community transmission, so they are spreading the condition. Now, why does this matter? Because young adults very often don't get severe disease. Well, there's a few things. First of all, occasionally they do. Sometimes they do get quite severe disease. Thankfully, not very often. But, of course, they spread it to other people, as we're going to concentrate on. But the other thing is, I've been doing some talking lately to people, and I'm hoping to get some more information on this in the next week, on people with long COVID. And the proportion of young people who get this longer term COVID, longer term complications, or more strung out disease in young people may turn out to be about the same as the percentage in older people. Now, those percentages are small. We don't have fixed data on it yet, but it's not something we would want to lightly ignore at this stage, because it's a big thing we simply don't know at the moment. So I don't want young people to be complacent about this. But let's go on and look at some more data from the States here. Southern United States, June 2020. Increased percentage of positive tests among adults aged 20 to 39. Again, relatively younger age group. Increased amongst those aged over 60, 4 to 15 days later. And this is what we've been saying for a long, long time now. The younger generation are carrying it home to the older generation. Now, I've got a pretty hard-hitting video from Scotland here I'm going to play you. It's quite simple, but it really is packs quite a powerful emotional punch, really. I can only get it in low resolution, so I hope you can follow it on that resolution. Let's go.
Hey, Grandad.
Hello there.
Cup of tea?
Lovely. I'll be back in a minute. Thank you very much. Lovely cup of tea.
Hey, Grandad.
I mean, that really is. I think that's quite a powerful video. So the young lady there's been out at a party the night before, takes it back to Grandad the day after, and of course his chances of getting severely ill are not insignificant. So that is this is the trend that's been seen in the United States. So therefore, what do we do about it? Because of this increase 4 to 15 days later in the older generation. strict adherence to community mitigation strategies, personal preventative behaviour by younger adults, and this it really does include less intergenerational mixing for a time, I really think. I know it's difficult, but I think it does include that. Reduced infection and subsequent transmission to persons at higher risk for severe disease. This is what we need to do. So this is the idea of shielding those at higher risk. Now that was a grandad in that clip. It could have been someone with a comorbidity. It would have been the same risk effect if that had been the case. Now, good news from Australia. Now, most of Australia's done remarkably well in this pandemic. Remarkably well. We looked at Western Australia the other day, which is a major success story. But then Victoria well and truly dropped the ball in the Melbourne area. What happened was people were coming back in to be quarantined from other states, and the calibre, let's say the calibre of staff who were supervising these quarantine hotels were questionable. For example, it was questionable whether some of them should have been having sex with the residents. That's open to question, isn't it? Obviously, I'm being satirical here. It's just absolutely ludicrous. There was bribes. They completely dropped the ball. It wasn't supervised by proper forces. It was supposed to be supervised by police, military, properly trained people. And instead they got a bunch of cowboys in and who, surprise, surprise, they messed it up. That's how the pandemic got into Victoria. Complete disaster. But once they realised the problem, let's look at the result of the action that's been taken. It is impressive. This is the official site for the Victoria government. Check it out. Last 24 hours, 16 cases, now up to 20,000 this is in Victoria, Greater Melbourne area mostly, 2 deaths. Active cases down to 339. Tests going very well, hospitalised 15, 9 of whom are in intensive care. Now let's look at the shape the graphs should be everywhere. Just get rid of me. Let's have a look at this. This is quite a powerful graphic. So we see the original spike here back in March, April, brought under control very quickly. Then we saw the bit of the disaster unfolding here in Melbourne, mostly in Melbourne. Wow, dear me. They brought in the measures. Now, if they hadn't brought in the measures, this would have happened. It would have been off the scale, but they did. And this is what the curve is supposed to look like with the effective lockdown measures, which have been fairly stringent, of course. Then the trend has come down really quite in a quite satisfying way like that. So that is what good. This is a textbook study on what good community health measures can do, what they can look like. So restrictions aren't being fully eased. I think they're taking away the curfew from midnight to night. So that's good. It's what they call move to second step of easing restrictions. Curfew lifted from Monday. Sorry, that's it. Curfew lifted from Monday, tomorrow. Now, this is interesting. Higher on the spot fines for breaches about visits to your home and outdoor gatherings. So the authorities have clearly identified this as a source of infection, a source of spread. So they're taking making that restricted. Reasons for leaving home actually remain the same now: food or exercise, permitted work, caregiving. Phased return for some education is going to be started soon. Religious gatherings, outdoors, 6 people can gather now, 5 people and a faith leader can gather, but outdoors. That's the crucial difference. As much as you can, stay at home. So not quite there yet, but wow, what a fantastic. I'm just going to look at that graph again. Isn't that, if only that was the case in my country, and indeed perhaps in your country. And of course, when you leave home, you must use a face mask. So Christie's emailed in. In 2 weeks' time, if we hit the average of 5 cases rolling for 5 cases a day for a rolling day average, old mate Danny Andrews, who is I always get this wrong. Is it the Premier? I think it's the Premier in Australia. Apologise to all Australians if I got that wrong. I think it's the Premier of the state. So having dropped the ball at the start, well and truly dropped the ball at the start, it has well and truly been picked up again. So there you go. Make of Mr. Andrews what you want. has advised we can expect even more restrictions lifted than anticipated 6 weeks ago. So things are being lifted quicker. So hopefully in 2 weeks' time, and given the trajectory that we're seeing, in 2 weeks' time, I would expect that to continue, and I would expect the trajectory to carry on going down. And this has well and truly, with the isolation measures that have been taken, saved the rest of Australia. So, pity about the bad start, nice recovery. UK. Now, UK, right, not good. Not good at all, actually. R value in England is estimated at 1.2 to 1.15, dear me. Scotland, even worse. Wales, slightly better. R values. This means there is currently exponential increases in cases in the UK, albeit from low number bases, relatively low number bases, but it is certainly increasing. It's nowhere near what it was back in March, because remember, the 4,000 or 5,000 cases that were being reported each day back in March were underreported by a factor of about 50. The real numbers were about 200,000. But let's look at what we're getting now, and it is definitely climbing. That's the official number of new diagnosed cases. And tragically, that's the number of deaths yesterday and the day before. No, sorry, that's the number of deaths yesterday, making a total of 41,000. Sorry, my mistake. So just to be clear, there was 34 deaths yesterday. That is Saturday. 41,971 deaths now officially recorded. These are deaths that have occurred within 28 days of a positive test. But data has been collected from the 7th of March to the 11th of September, and there was 57,000 times that COVID was mentioned on the death certificate, and the assessed deaths for that time period as a whole is 64,000. So this number is clearly an underestimate. Yeah, it's an underestimate. Having said that, this number has probably been overestimated in the past 8 weeks, but these are the kind of numbers we're looking at with this level of uncertainty. Now, we noticed that the 6,000 new cases diagnosed in the UK yesterday in Saturday, but according to the COVID Symptom Tracker app, it wasn't 6,000 officially diagnosed cases. The real number, according to the COVID Symptom Tracker app, which has proved pretty reliable in the past, was 19,000 on Friday and 19,000 yesterday on Saturday. Now, I actually believe this COVID Symptom Tracker app because in the last few months, when we've looked at the retrospective data from the Office for National Statistics based on the national screening programme for antigen testing in the community, we find that the numbers that they're coming up with, which are always 2 or 3 weeks behind the times, of course, are actually pretty consistent with the COVID Symptom Tracker app figures for that time. So it looks like we've got this dramatic increase in the UK with these kind of figures, giving us 189,000 active cases at the moment in the UK, according to the COVID Symptom Tracker app. So there is no doubt that the trajectory in the UK is definitely increasing at the moment. Probably not increasing probably not doubling every 7 days like Patrick Vallance feared, but nevertheless increasing. Now, how does this transpose into hospitalisations and things? Yep. So, for example, University Hospital Trust Birmingham. Sorry, that thousands self-isolating should be in another place. Ignore that. Definite problem in preparation there. Right, so University Hospitals Birmingham Trust. 11th of September, not that long ago, they had 72 patients in the Birmingham University Hospital Trust. Pretty big hospital setup. 7 patients with COVID-19, 7 of those in intensive care. A couple of days ago, on Friday the 25th, that 72 have gone up to 124. That 7 had gone up to 18 in intensive care. Now, these are still manageable numbers. I'm not alarmed at that. It's tragic for the people that are suffering. But this is something that we can cope with. But the trajectory is higher. And we know that these increasing cases from the COVID Symptom Tracker app, these 19,000 cases, are going to feed through. They will feed through. Going back to the current data though, 25th of September, yeah, we did that. So 22 deaths in the past 2 weeks. So again, deaths starting to increase slightly, but this is what's concerning me. 72 to 124, 7 to 18 increases. Now at the moment we have these regional restrictions, and the restrictions vary from place to place and they do change a bit and it all gets a bit confusing. But basically the UK is following this strategy of localised restrictions, not quite lockdowns, but restrictions, different restrictions that are identifying areas where the transmission is highest. And I think it's a good strategy because the alternative is applying it to the whole country with all the economic and social consequences that has. So I agree with this government strategy. It is working. But these are the areas at the moment: Scotland round about Glasgow, restricted areas, Newcastle, this whole area in the northeast currently restricted. Leeds, Manchester, sort of Liverpool, conurbation area there affected. Leicester's been bad for a while. Birmingham, and new restrictions being brought in areas of South Wales, around Cardiff. So that's the kind of patchy situation in the UK, and the more targeted response. Now, I actually think this is the right thing to do. Now, if you've been listening to this podcast, you'll know that we anticipated, you and me, that there was going to be significant problems in education, particularly in universities. And we anticipated this a month ago, probably 6 weeks ago. We've reiterated it several times. It was obviously going to happen. There was epidemiological models that suggested it was going to happen. But for various reasons in the UK, which I'm not going to go into, related partly to university politics and finances, many students were brought back. Now, how many students are now infected and self-isolating in their halls of residence, particularly first years, not exclusively, is not known. The number is not published, but it's certainly in the thousands, several thousands of students. We don't know how many, but thousands. Universities badly affected. We looked at recently Glasgow, Manchester, Metropolitan, Edinburgh, Napier, where students are isolating in halls. Now, the question is, if students are isolating in the bubbles, that's good because we don't want the infection to get out into the community. It was inevitably going to happen because we've got students from all over. We looked at one student yesterday in Scotland, I think it was, and in her hall, people have come from 42 parts of the country. You only need one of them to have the infection living in that sort of situation. And of course, that's exactly what has happened. And the problem is, it's not clear when this is going to go away. So the infection can carry on spreading through student populations all the way till Christmas, which means that thousands of students could be faced with the prospect of being isolated in their halls over Christmas time. The alternative, as we saw on that powerful video from Scotland, would be taking the infection home to their relatives. So has this been well thought out? I'll let you decide that, but we did anticipate it weeks ago on this video. Now, just quick whiz around France and Europe before we finish today. Looking at France first of all. So a lot of new cases in France past 24 hours. It's increasing remarkably quickly. France in the last 7 days. Now, because this has been increasing for a while, hospital admissions are now starting to go up. 34,000 admissions, up 34% on the past week. ITU admissions up 40% on the past week. A&E admissions with COVID up 21%. These are all specifically COVID related. Hospitalisations, intensive care, A&E admissions up. Again, the numbers aren't yet massive, but the trend is upwards. Deaths, unfortunately, already starting to rise, up 25% in the past week. Paris, Marseille particularly affected, but other areas as well. And because of the increasing cases we have in France now, there's no question that's going to feed through to more hospital admissions, more intensive care admissions, more A&E admissions, and it's going to feed through into more deaths. It's inevitable as night follows day, unfortunately, because of the proportion of people that are going to, unfortunately, succumb to severe COVID. Now, the French authorities, this chap, National Council for the Order of Doctors, well-known national medical organisation in France. He's actually the boss of this, he's the chair of this. In 3 to 4 weeks, if nothing changes, France will face a widespread outbreak across its whole territory for several long autumn and winter months. This winter is going to be the problem for you and for me. Wherever you live, it's this winter that's going to be the problem. France's healthcare system will be unable to meet all the demands placed on it. Wow. I mean, that's what he's saying. Now, back in March, April, there was many health facilities that were severely stretched, of course. But perhaps the only place where health authorities actually ran out of capacity to treat patients was the intensive care capacity in North Italy. Heroic efforts across Europe meant that the vast majority of people that needed treated were treated, just lack of capacity in North Italy. The other main problem in Europe was Sweden. Now, Sweden issued guidelines, as I understand this, to restrict people going into hospital, going into intensive care from care facilities, in anticipation that there'd be lots of people going in, but that the intensive care units in Sweden were never full. In the meantime, people were dying through simple hypoxia in care facilities. And not only that, were given morphine in care facilities instead of giving oxygen. And morphine, of course, is a classic drug. It's a brilliant painkiller. It's a wonderful, wonderful drug. But it does suppress respiration. It suppresses respiratory effort. And I really feel there should be a European inquiry into what I feel amounted to a mass euthanasia campaign in Sweden. Now, if the Swedish authorities want to give counter-argument to that, of course they can. But it's clear in my mind what constitutes euthanasia and what constitutes palliative care. I feel I know the difference. And I feel the line was well and truly crossed in Sweden. Slightly separate issue. But basically what I'm saying is that the main places in March, April that people died through lack of medical care was Sweden for these infrastructural, logistical, whatever it was, political reasons, and Italy, where there was a short period of time where intensive care was not available. Perhaps why the Italians are doing so well now. They've learned from that lesson. Now, Europe. Now, just before we go on to Europe, I don't want to carry on too much of a rant, but where is the leadership from the European Union on this? It really does seem to be a deafening silence from European leadership. Where is the coordinated response that Europe trumps so much? Quite deafening by its absence, really. I really feel that the European Commission and the European, whoever they are, should really step up to the plate on this and do lead. That's what they're there for. They're there to lead. Now, the information here comes from the European Centre for Disease Control, the CDC for Europe. So always, of course, check what is being said against facts. Hospitals and ICU admissions increasing in the following countries. This is as we speak at the moment, at the end of September. All these countries: Austria, Czech, Denmark, Estonia, France, Greece, Hungary, Latvia, Portugal, Slovakia, Slovenia. Hospitals and intensive care things increasing in these countries. Again, not at terrible levels, but increasing. And basically the cold weather hasn't even started yet. But already there's an increased death rates in Bulgaria, Croatia, Romania and Spain. And of course all of these reported increasing cases 2 months ago. And again, as we anticipated on this channel, the increase in cases. Well, everyone anticipated, but we did point out, we certainly pointed out Spain. I can't remember. I think we pointed out Romania. Anyway, the increase in cases are now feeding through into increased death rates with this 2-month lag as one person passes it to another person who passes it on to a vulnerable person. And of course, we're just at the start of the winter. High levels or sustained increase in over 65s, European Centre for Disease Control. Now, what's happened is that the pandemic has spread in late summer amongst young people. It's now spreading into older people, as we saw in that Scottish video. Higher levels or sustained increase in over 65s now. This is actually a reality now in Austria, Ireland, Luxembourg, Malta, Portugal, Romania, Spain, Sweden and the UK. We anticipated this, and the spread to the older generation is now starting to be with us in these countries. So it's going to be a difficult winter. Not to forget the rest of the world, just put a couple of notes here together on Mexico, which seems to be suffering quite badly. We have no idea what's going on in Mexico because basically there's hardly any testing. So these numbers are massive underestimates. So just spare a thought for the people of Mexico. Okay, so yeah, that's an update for Sunday. Australians have done well. America seems to be sort of carrying on. Unfortunately, no great drop off in America. And whether you want to call it a sustained increase in cases in Europe or whether you want to call it a second wave in Europe doesn't matter too much. But I think, unfortunately, over the next weeks, well, I think we can say for sure we're going to see increased hospitalisations and deaths to some level over the next weeks. We know that from the increase that's happened already. And given the rapid increase in many countries, UK, France, Spain, the complications to some members of the population are going to occur. It's going to be the potential for a difficult winter is there. Let's take any measures we can to mitigate that now. Let's not forget the simple things. Wash your hands, maintain physical distance, wear your mask in all public places, do things outdoors rather than indoors if you possibly can. And it's still not being done. I know I go on and on about this. I still go into shops and the doors are shut and the windows are shut. We need to ventilate public spaces. All indoor public spaces need to be much, much, much better ventilated. And if that means we get a little bit chilly, then so be it. Let's put on a thermal vest and keep the windows open for longer and delay the closed-in effects of viral transmission that are associated with winter in the northern hemisphere. Thank you for watching this video as always.